Good afternoon and welcome to VAX Facts and FAQs. My name is Amiris Robertson and I will be walking us through today's presentation. So a little bit about VAX Facts and FAQs. This is a virtual presentation for those affected by chronic kidney disease on how to stay healthy and get up-to-date information on flu and COVID-19. This presentation will cover pandemic updates, Boosters 101, and provide some information to better prepare you for the upcoming flu season. And of course, we'll end with FAQs. So first, the pandemic updates. So one tool that we have to monitor COVID-19 is monitoring the community levels. So if you look over at this map, this will show us Michigan, and Wayne County and nearby counties have a medium community level for COVID-19. And like I said, monitoring the community levels is a great tool to gauge what protections you need to practice to minimize the risk for COVID-19. And so there's these different classifications. There's low, there's medium, and there's high. And for the medium community level classification, it's recommended that you, of course, stay up to date with your COVID-19 vaccines, get tested if you have symptoms, wear a mask if you have symptoms, a positive test, or if you've been exposed to someone with COVID-19. It's recommended that you wear a mask on public transportation, and you may choose to wear a mask at any time as an additional precaution during medium community levels. And if you're someone who's at high risk for severe illness, you might want to consider wearing a mask indoors and taking additional precautions. And so the next thing we're going to talk about is the boosters. So boosters are necessary due to our protection or our levels of antibodies waning over time. And this is a very normal occurrence. It's normal for virus-fighting antibodies to wane over time. And so being up to date restores this protection and restores the level of antibodies. The newly authorized bivalent boosters provide protection against the strains that are most prominent, the BA4 and the BA5 variants. And that is something that's cool and unique about the mRNA vaccines. They can be modified in this way to target the circulating strains or circulating variants of the virus relatively easily. And the CDC, has tools that can help us determine if we are up to date with the vaccine. And right now, the current simplifications have been, or the current recommendations have been simplified a little bit. So the current recommendation is you are up to date, or I guess I should say the definition of up to date is if you have completed a COVID-19 vaccine primary series and received the most recent booster dose recommended to you by the CDC. And so right now I'm actually going to walk you through the CDC tool that is available so that you can see how you might use it if you are curious about if you need a booster right now or not. So if you Google CDC stay up to date with COVID-19 vaccines, this page should show up. And what you want to do is scroll down to the bottom, and there's this tool here, and it says find out when to get a booster. So we're going to click on that. and it's going to start to prompt us for questions. So the first question is, how old are you? So you want to click on your age group. And next, they're going to ask you if you have a weakened immune system. So are you moderately or severely immunocompromised? So this might include those with chronic kidney disease, those who have received an organ transplant, and there's some indicators down here to help you determine if that is your situation or not. So for this example, I'm going to say no. And now it's going to ask you, which vaccines did you receive for your primary series? So did you get mRNA, 2 doses of mRNA? Did you get 1 dose of Johnson & Janssen vaccine, 2 doses of Novavax? Or did you get a vaccine out of state or received a vaccine as part of a research study? So I'm going to say 2 doses of an mRNA vaccine, so Pfizer or Moderna. And then, have you had an updated booster? And so what it's asking here is, have you received the newest bivalent booster? And for this example, I'm going to say no. And now a key portion is, has it been 2 months or longer since your last COVID-19 vaccine? So if you have received the monovalent booster, or kind of the past booster, you can receive the bivalent booster after 2 months. So that's what it's kind of trying to gauge here. So, excuse me. So for this example, I'm going to say yes. And so then I get my responses. So it says what I've said, and then it's going to say, based on your responses, you should get an updated bivalent booster using Pfizer or Moderna. And so this is a great tool to help you kind of gauge what vaccine you might need to be up to date with your COVID-19 vaccine. And you can use this to help gauge whether your kids are up to date, etc. And if this is still unclear or you're not sure of the answers to these questions, you can always consult your vaccine administrator or your primary care physician, and they can clear those things up for you. Okay, so we're going to move on. And like I said, the current recommendations have been simplified a little bit. When we've gone over this chart in the past, it was a little hectic and there was a lot going on. But now it's relatively simple. And the key thing, again, is to note is if you have received a monovalent booster or the past booster, you are eligible for the bivalent booster after 2 months. And that's true for those that are 12 years and older. You can see that right around here. And this is because the bivalent booster has not been available for those younger than 12. And this is the schedule for those who are immunocompromised. So there are a couple things to note here. There is still a 3-dose primary series for those who are immunocompromised. And except for Novavax, of course, because that hasn't been authorized. But for Moderna, Pfizer, that's what's true for this group of people. And again, if it's been 2 months since your last booster, so you got the monovalent booster. If it's been 2 months, you are eligible for the bivalent booster. All right, so now we're going to provide you with some information regarding the flu season. So flu season is typically around October and September. So it is recommended that people get their flu shots between that time, so September and October. However, being late should not deter you from getting the vaccine. Flu activity can continue well into the spring. So there's still some benefit from getting your flu vaccine a little late rather than not getting it at all. And currently the recommendation is that everyone 6 months and older should get a flu vaccine during flu season. There's very rare exceptions, but your primary care physician, vaccine administrator can help clear that up for you if there's a specific vaccine flu vaccine you should take, or if you may not be eligible for a flu vaccine, or if it's not the best option for you. And like with COVID-19, there are all sorts of protective behaviors that we could implement to lower our risk of getting the flu. So obviously, flu vaccination still is the best way to reduce your risk of getting the flu. But there are other protective measures that can kind of pair alongside the vaccine to help further reduce risk. So that includes hand washing, covering coughs and sneezes, and avoid touching your eyes, nose, and mouth. So now we're moving into our frequently asked questions portion of the presentation. So the first question is, I am 65 years old. Is there a specific shot that I should get? And the answer is yes, and this is a little complicated, so I would definitely recommend that if you're 65 and older, that you consult your vaccine administrator or your primary care physician to help better explain this recommendation. But the recommendation is that those that are 65 years and older may get a higher dose or rejuvenated flu vaccine. Now, there are a few different brands for this vaccine, but there's no recommendation for one or the other. So again, please consult your doctor if you're 65 and older on what your best plan of action is for getting your flu vaccine. When is the best time to get an influenza vaccine? Like I kind of mentioned earlier, September and October are generally a good time to get vaccinated against the flu. Again, ideally everyone would be vaccinated by the end of October, but things happen that can't happen all the time for everyone. So vaccination is still recommended and effective after this time. So let's say you're into November, you're into September, or no, December, you can still get protection from this vaccine, and flu activity could still be heightened at this time. So it is still recommended to get the flu vaccine, even if you are a little past October or a lot past October. Can I get my COVID-19 vaccine at the same time as my flu vaccine? The answer is yes, you can get your COVID-19 vaccine at the same time as your flu vaccine if you are eligible and the timing matches up for you. Even though vaccines can be given at the same visit, we don't want you to put off your COVID-19 vaccine to get them at the same time. So if you have the availability and the access to a COVID-19 vaccine now, you should definitely get them now and not hold off to get them at the same time as your flu. There's no additional benefit or no benefit that is worthwhile to waiting and putting it off. So don't put it off for the sake of additional benefits or anything like that. It's not really worth it. And it's more beneficial to get your protection from COVID-19 now as it's actively circulating and there's a true risk to getting COVID-19. And so ideally, again, just try to get your flu vaccine by the end of October, but don't push off your COVID-19 vaccination just for the sake of getting it together. If you can get it now, definitely do so. Are we going to have to get boosters every 6 months? Why are we always asked to get another booster? And the best answer I can provide is that the updated recommendations are here to simplify the recommendations at this time. So, like I said, that graph that had the vaccine schedule, it used to be a little bit more chaotic, but now the recommendations are simplified. This is the first booster, the bivalent booster, that is tailored to the circulating variants. So this is a great opportunity to bring COVID cases down, COVID deaths down, COVID hospitalizations down. And many experts are optimistic of the outcomes of this booster. And not to say that they're thinking that this booster will end the pandemic, but again, that it can bring some of those cases, hospitalizations, and deaths down from these circulating variants. And regarding the timeline, there is no way to be sure what the schedule will look like going forward, but the ACIP, the FDA, the CDC, they're constantly monitoring cases and monitoring the research outcomes to make sure that the current recommendations are the best recommendations for the public. I think ideally we would want it to be more like 6 months for the people, for experts. I think that's what we would hope, but there's no way to know that if the research at this time is going to allow or suggest that outcome. So I think the best thing to realize is that these recommendations are suggested to keep us safe and to be the best option to prevent, those hospitalizations, those deaths, those severe illnesses, and just doing what's best for the public at this time. So, unfortunately, we just don't know just yet what the schedule is going to look like. So I thank you for watching our video today. If you have any questions or feedback, feel free to reach out to us at reach@nkfm.org or visit nkfm.org for more information. And if you're interested in our next stream, please feel free to register at nkfm.org/COVID-19. Thanks again for watching.